What do you know about borderline personality disorder? Often referred to as BPD, this condition significantly impacts those who live with it. It's characterized by intense emotional shifts, impulsive actions, and difficulty in maintaining relationships. BPD typically manifests during late adolescence or early adulthood, affecting various aspects of a person's life, including personal relationships, professional life, and overall health. BPD is a complex disorder that's often misunderstood, but today we delve deeper into it. Diagnosing BPD is not a simple task. The symptoms often mirror those of other mental health disorders, leading to potential misdiagnoses. It's like trying to find a unique pattern in a kaleidoscope of shifting colors, and managing BPD isn't any easier. The disorder's emotionally volatile nature can strain the therapeutic relationship. This calls for a specialized approach that's as unique as the disorder itself. Thus, a comprehensive understanding and specialized approach are imperative for accurate diagnosis and effective management. Consider a case of a 28-year-old female patient. From the outside, she seems like any other young adult. However, her internal world is a whirlwind of intense emotions and instability. She describes her life as an emotional roller coaster, with extreme highs and lows occurring within a short span of time. This emotional turbulence has taken a toll on her personal and professional life. After losing her job, her emotional health spiraled downwards, causing disruptions in her daily life and relationships. She also began resorting to self-harm as a means to cope with her emotional pain. From a young age, she has sought professional help, and she has been hospitalized twice due to suicide attempts. Despite trying various treatments and medications over the years, her condition has persisted. Her life is a vivid depiction of the emotional turmoil that BPD patients often experience. During her consultation, she appeared anxious. Her demeanor and expressions were indicative of an underlying emotional turmoil. Despite this, there were no signs of acute distress, pointing to the complexity of her condition. Her behavior, however, was a clear signal of deep-seated emotional instability. To ensure a comprehensive understanding of her situation, we conducted several diagnostic tests. These included a full physical examination and blood tests, primarily to rule out medical conditions that could explain her symptoms. We also administered tests to rule out the effects of illicit substances. All results were within normal limits, which was critical in shaping our understanding of her condition. This process of elimination is crucial in psychiatric diagnosis. It ensures that we're not attributing symptoms to psychological disorders when they could be the result of physiological issues. The absence of an underlying medical cause led us to consider a psychiatric diagnosis, thus highlighting the importance of thorough physical examinations and diagnostic tests in mental health. Her mental examination revealed rapid emotional fluctuations. Her conversations often seemed disjointed, bouncing from one topic to another, indicative of tangential thought processes. This was one key sign that pointed us towards a potential diagnosis of borderline personality disorder. However, it's crucial not to jump to conclusions in psychiatry. We had to ensure we were not dealing with a different condition with overlapping symptoms. So, we started the process of differential diagnosis. We considered bipolar disorder, major depressive disorder, and even certain personality disorders. Each possibility was systematically evaluated and eventually ruled out. It was a meticulous process involving a thorough review of her medical history, symptomatology, and overall behavior. Finally, we arrived at the conclusion that BPD was the most fitting diagnosis. It aligned best with her history of intense emotional instability, impulsivity, and relationship difficulties. BPD was the diagnosis that best aligned with her symptoms and history, and it's a condition that requires a specialized therapeutic approach. This case was a reminder of the complexity of psychiatric diagnosis and the importance of a multidimensional approach. It's not just about ticking boxes on a symptom checklist, it's about understanding the individual, their experiences, their emotions, and their struggles. The interplay of biological, psychological, and social factors is always at the heart of mental disorders. In this case, we saw how the patient's emotional instability, personal history, and social circumstances all contributed to her condition. It's a vivid illustration that mental health is not an isolated element but intricately linked with all aspects of a person's life. This case also served as a stark reminder of our ethical and legal responsibilities as healthcare professionals. When dealing with patients at risk of self-harm, every decision we make carries weight. It's crucial to create a safe, supportive environment where patients feel seen, heard, and cared for. It's about more than just prescribing medication, it's about providing hope and a path towards healing. Furthermore, This case emphasized the critical role of ongoing education and adaptation in our profession. As mental health professionals, we must continue to learn, to understand new research findings, and to adapt our methods accordingly. Because at the end of the day, our goal is to provide the best possible care to our patients, to guide them through their darkest hours, and to help them find their way back to a fulfilling, meaningful life. As professionals, we must continue to educate ourselves and adapt to provide the best possible care to our patients. BPD is a complex condition, one that interweaves the psychological, the biological, and the social aspects of a person's life. It's like an intricate tapestry of emotions, behaviors, and relationships that can sometimes feel overwhelming, not just for the person living with it but also for those trying to help. Yet despite its complexity, it's crucial to remember that there is hope. With the right approach, we can indeed improve the lives of those living with BPD. It's not about curing the disorder, but rather about managing it, helping patients navigate their intense emotions, fostering healthier relationships, and empowering them to lead fulfilling lives. It's about understanding their world, their experiences, and their unique challenges. It's about being there, walking alongside them on their journey towards recovery. As mental health professionals, it's our duty to bridge these gaps. We must advocate for accessible, high-quality mental health care for all, regardless of where they come from or what they're going through. Let's strive to provide the best possible care to our patients and continue to educate ourselves about disorders like BPD.